It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Candace Kruger along with Jim Knox. We're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that are helping to change people's lives.
Speaking of helping change people's lives, we'll start with our first best doctor, oral surgeon, Dr. John Wallace.
Before coming to see Dr. Wallace, I'd had implants, and my implants were put in or finished by May 1989. And all of a sudden, in February of 2011, the top went south. I knew the implant was loose and it hurt, and my dentist, of course, recommended Dr. Wallace.
Shirley came to us with a little concern. She had had a lot of dentistry done in the past, and she had actually had implants years ago. They had replaced several teeth. She had very big bridges, and they were getting loose, and she knew that there was a problem. She was having some pain.
The way they're doing it now, all Dr. Wallace did was pull the teeth, put the implants in, and you get teeth same day.
We saw Shirley, and immediately we knew we needed to move forward with an EverSmile procedure for her. This gave us the ability to remove all the remaining teeth that were bad. Once we had that done, we were able to place implants and give her a whole new smile the same day. She was ecstatic.
My friends don't even know. They knew that I went through it. They're just amazed how pretty my teeth are.
So when Shirley came in, we got a 3D CT scan. We evaluated the remaining bone and the teeth and decided the EverSmile was the perfect procedure for her. She came in for surgery. We removed all the bad teeth. We put in all new implants, gave her a whole new set of teeth. And I tell you what, within minutes of waking up, she's in the mirror, she's ready to go. She is, again, going a million miles an hour. And the EverSmile that we gave her is probably the only thing that's going to be able to keep up with her.
But I mean, I was up and at 'em. I had it done on Thursday, and I was back playing bridge on Monday.
So now we combine the success rate of implants, which is single-handedly the most successful form of dentistry we have. We use that type of technology, the latest and most advanced imaging and planning techniques, and give her a new EverSmile. It's highly successful. It goes in the same day. It's exactly the teeth she wanted. You can't do that with anything else in dentistry. It's amazing.
Anatomically, when we have colon cancer, it spreads from the wall of the colon into the lymph nodes and then elsewhere. Well, up inside the abdomen, we can get way around these areas and include all the lymph nodes and everything else, whereas with rectal cancer, we're restricted by the bones of the pelvis. So it's more difficult to get widely around everything. We use radiation and chemotherapy in locally advanced rectal cancer, whereas we don't use radiation hardly at all up in the abdomen when we have colon cancer.
Being transferred to Argentina, just making a simple dinner for the kids one night. Getting ready for bed, I went upstairs just to go relax and stretch out. We had only been there a month in Argentina. We were going to be there for 2 years. Went upstairs, got ready for bed, went to the bathroom, and it was full of blood. Woke up the next morning and the same thing happened, and absolutely no pain.
She developed some rectal bleeding and went in and subsequently underwent colonoscopy. She was found to have a polypoid growth right at the rectal sigmoid colon, and they took it out. Over the next 24 to 48 hours, she developed some lower abdominal discomfort and came back in to her physician to check it out.
And about 48 hours later, they gave us the news that it was full of cancer.
They recommended immediate surgery, but she didn't want to have surgery down there, so she called from there.
And I remember calling him from Argentina, and literally he says to me on the phone, okay, but I want you to get your butt on a plane, and I want you to come home and let me fix you.
We took out the section of small bowel along with the section of the colon and all the lymph nodes. The final pathology showed no residual cancer. Now she's 13 years out and doing fine.
Most people don't look forward to colonoscopies. I look forward to colonoscopies because I finally get to catch up with Dr. Cloud. I'm crazy about Dr. Cloud. I'm crazy about him. It's his personality. It's his comfort. He's a great guy.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
A number of things have sort of developed in dermatology over the last year and a half that have been very exciting that relate to what we do here at our laboratory. For malignant melanoma, which we diagnose many of those here each and every day, is that there are actually new drugs now that can treat melanoma, and that's something that we've not had at all for many, many years. One thing that we're doing is sending these tumors off to ensure that that marker is present. If it is, and the people are eligible for treatment of this very new, exciting drug. We make the diagnosis of the basal cell, and then once that's made, then if it's one of these terrible cancers that can't really be treated with surgery or even radiation, then they will be eligible for this new drug. We play a vital role here in making diagnoses of skin disease, but we interface a lot with dermatologists and non-dermatologists too, plastic surgeons, general surgeons, in recommending treatment options, not just medical treatment like drugs, but also surgical treatments and even other new, relatively new treatments, one of which is now radiation therapy that's being reintroduced back to dermatology. There's a fairly new device that's just recently been developed that's a small X-ray device that dermatologists can use in their own office and actually treat skin cancers. Years ago, that used to be the #1 way that skin cancers were treated. Now most of them treated with surgery, but there are some patients in select cases that are good candidates for radiation. And we can look under the microscope and tell the doctor whether that cancer is going to be a candidate for radiation if they're not really a good surgical candidate. Labs like this one play a vital role in determining the diagnosis of these types of cancers, not only melanoma, but basal cell carcinoma, many other things. And we're now interfacing with labs that do genetic testing and then getting more personalized medicine where you get a diagnosis, you see what the cancer's genotype is, and then you can decide whether there could be a therapy that can be tailored to that individual person. So this is an exciting new development that we're going to see happening more and more in medicine.
Vicky had sinus pressure with pain every day until she met Dr. Joshua James. To find out more about Vicky's story and other life-changing stories, log on to bestdocsnetwork.com.
Miss Skiles is a professional photographer. She travels all over the place, carrying heavy equipment. In 2009, she started having intense pain in her lower back with sharp shooting pain and tingling going down her left leg all the way down to her foot.
When it first started and it got really intense really quickly, I couldn't drive, I couldn't walk. I was worried that I wasn't going to be able to do photography to do my job. So it was really intense and really bad.
She tried chiropractic care, physical therapy, medications. Nothing really made a gigantic difference.
We discussed pain management with pain pills, muscle relaxants. We discussed the option of surgeries, which I did not want to do and still don't want to do. I'm going to hold out as long as I possibly can.
She was sent into pain management. The MRI she did showed significant disc herniation in her lower back, pinching the nerve going down her left leg. At the time, we did a series of epidural steroid injections in her lower back. The pain down her left leg is gone. She's able to do her job, able to drive, able to walk. She's doing a lot better compared to before. She's very satisfied with her care.
I'm very comfortable with Dr. Farhat because I think that we both are working towards the eventual goal of pain freedom. I respect him as a doctor and I appreciate his hands-on human touch.
I can say that we achieved pain freedom in regards to her leg pain. She's still having achiness on and off in her lower back when she's active and at work, but for that she takes only an anti-inflammatory medication and occasionally a pain pill. Overall, she's very satisfied with her care and the pain relief we provided for her.
He gets that I can't just lay back and wait for things to heal, that we're going to work together to be completely healed at some point.
As a pain management specialist, my goal is to achieve pain freedom on any patient we see and treat.
Do you have headaches? Of course you do. You're a human being. We've all had headaches. There are different kinds. There's migraine headaches. Those are not the most common kind, but they're the most bothersome. They are usually pounding, throbbing headaches, usually on one side of your head, often accompanied by nausea and vomiting. Sometimes there's light sensitivity or noise sensitivity. Best way to get rid of those is to take some over-the-counter pain medication, even drink a cup of coffee real quickly. Sometimes going to sleep will help get rid of one of those headaches. By far the most common headache is the muscle headache or a tension headache. This is the headache that may last days and days and days. It's usually a squeezing type pain like a band around the top of your head, or it can be right in your temples or your forehead or the base of your neck. It's not throbbing, it's steady, and it's caused often by stress, and sometimes it's caused by taking pain medication too often. It can be like a rebound headache. So what should you do for these headaches? There's medication for them. First of all, try relaxation, try sleep. Exercise always helps headaches go away quickly.
Pediatric flatfoot is a deformity in which the arch of the foot is not normal in respect to when the patient is standing. Initially, when they're young, it may or may not be symptomatic, and that usually kind of determines whether or not what type of treatment we need to perform. If it's asymptomatic, that gives us a few more options as far as treating it conservatively with items such as custom orthotics or inserts for their shoes. And if it's symptomatic, then that leads us a little more towards possibly reconstructing the foot surgically.
I came here because I was born with a short Achilles and I had flat feet. It would affect how I would grow up and how I ran and all that, and it hurt a lot and just affected what I did physically.
When Justin came in, his parents stated that they were concerned because he was actually reporting pain along the inside of his foot. Due to that pain, he was not as active as they thought he should be.
They measured my feet and they did x-rays, and he told me to walk and all that back and forth and see how I walked and how my heel was doing.
Once they hit about 10 years, 12 years of age, if it is symptomatic, then you can actually do surgery to reposition the foot and prevent problems that usually go unnoticed until they're later in life.
I was tiptoeing and my feet was going up and I wasn't walking right. He had fixed my feet so well. I was walking and running better, and I was able to do sports and all.
One thing that's very important about this condition is that a lot of people do not have it treated because there's a belief that the child will grow out of the deformity. Although surgery is not required, if left untreated, they likely will require some type of orthotic or insert for their shoe permanently.
He's helped me change how I can do things and how I can run, walk, and do things physically. I'm pain-free since I already did the surgery and this feels better.
The feeling of correcting someone's foot in this manner so that they are productive and happy and not limited in their activities is extremely rewarding.
I'm a board-certified allergist, and I treat patients with allergies, asthma, and clinical immunology problems like immune deficiencies. The scope of practice of allergy covers people with things like hives, frequent infections, itchy, sneezy eyes, nose, throat, a lot of coughing problems and asthma problems, chest problems related to their allergies. The Dallas-Fort Worth environment is very good at producing pollen, and we have probably more patients come in complaining of pollen allergies than any other type of allergy.
Prior to coming to Dr. Baxter, I tried several other things, but really I was doing self-medication, just pretty much living with what I was having to put up with, thinking this is just the way it is and I just have to deal with it.
Michael is a person who's had allergies pretty much all his life. They've been severe. He just wasn't able to stay well. He would have very frequent ear infections and basically stayed infected. I think his sinus infection never really cleared up. So we tested Michael. He is very, very, very allergic to just about every pollen that there is. And I remember his back was just very, very blown up with big reactions. And so to tackle that requires careful formulation of his immunotherapy and faithfully taking the shots for quite a long time to actually get the treatment up to the level that you need it to be to really give him protection.
If I have an infection or a cold or anything, I really don't even get that bad with those infections. So it just changes your whole lifestyle and your whole perspective on things.
His allergies were causing the frequent infections that he was having, and he's really not having those anymore now that he's taking his shots, and his shots have been able to be built up to a high dose.
My life changed a lot after having the shots because I went from having to take antibiotics once a month to about every 3 months, and then now it's the rare occasion that I have to come in and see Dr. Baxter for any infection medication.
For more information on any of the great doctors you see on today's program, head to the website bestdocsnetwork.com. And Candace, I'm excited to introduce the next doctor because this doctor actually helped our producer, Diane Faison-Rowe, with her broken foot.
That's right. It's time to meet Dr. Ed Singleton.
I was on a friend's boat and I missed my step and twisted my foot, and immediately I knew that something had happened. It hurt, but surely I didn't think I broke it. My friends were like, "You gotta go to the doctor, Diane, you gotta get that checked out." And I was like, no, it's fine, you know, I must have just sprained it or something. So I thought, you know, just with some time and staying off it, not being active, it'll heal itself. My job requires me to interview doctors as the producer for Best Docs Network, and I was at PAMA interviewing a doctor, and there happened to be one of their foot specialists there.
When I saw Diane's foot, it's like she had on a pair of nice red high heels, and one foot looked like it's supposed to, one foot looked like it was blowing up out of her shoe. And I said, "Is there something you need to tell me?" And we sat her down, we examined all the necessary parts, took some x-rays, and sure enough she had a fairly substantial fracture of the 5th metatarsal. Had it been much more significant, it probably would have been a surgical thing. If she had let it go a lot longer, it would develop into what's called a non-union, or at least a delayed union, and that means that the bone is not healing in a timely fashion. And if it goes all the way to a non-union, that's a surgical problem.
Dr. Singleton was great. Immediately he said, "You need to be wearing a boot." The fracture was such that it could be healed by just staying off it and wearing the boot, the cast boot. Otherwise, possibility of having to have surgery, pins, and all that. And I've heard stories about that, and I just didn't want to go that route.
That's why it's so very, very important to be seen for your injuries in a timely fashion by a qualified foot and ankle specialist. If you want pain freedom, you got to be seen early. She should do fine now that she's wearing it in a very diligent fashion. She tells me she wears it all the time, and she's being a really good patient.
I work with PAMA physicians quite a bit and hear about how they're able to provide their patients pain freedom. So it was really great to be able to experience that.
Before I went to see Dr. Swanson, I was 200 and something pounds. I had a 2-year-old little girl. I was on the sidelines a lot. You know, I was that big parent, not very healthy, not very active, and I wanted to participate more with her in her life and the things that were going on with her. She was 2, she was walking, running, and very active. So that's what drove me to go see Dr. Swanson.
The advantage of the sleeve is that when you remove that part of the stomach, you change the communication of your insides. People think of the stomach as just a bag to hold some food, and it makes some acid, and yeah, there it is. No, the stomach is an amazing organ. It manufactures several hundred chemicals that communicate to the pancreas and the liver and the brain and the fatty tissues. And all that communication goes on all the time. So when you remove part of the stomach, you change that communication. And that's when amazing things happen.
Within 2 weeks, 3 weeks of the surgery, I'd already had dramatic weight loss. To date, it's been a year from my surgery and I've lost 120 pounds. Life has changed dramatically. When I go to the doctor, my doctor is just floored at the progress that I've made.
People seem to have a place where they live as far as their weight. They've been 300 pounds for the past 10 years. Their stomach and their brain and their fatty tissue communicates and says, you need to live at 300. When you change that communication, on the day of surgery, their brain now thinks you should weigh 160. When your brain thinks you should be 160, and it's getting the signals from the fatty tissue saying, oh, we got all this extra reserve out here, the brain says, we got plenty of energy. We don't need to eat. And these people are not hungry. It's amazing.
If I hadn't had the surgery, I don't know what it would be like, to be honest. I mean, I wasn't there. I work out 3-4 times a week and it's not hard and it's easy now. And before it was just so hard. It hurt my knees. It just wasn't fun. And now I can go to the gym and I don't mind wearing the gym clothes and it's great. It's fantastic.
I got the tattoo about 10 years ago in my 20s, and it was actually the second tattoo to cover up a fraternity tattoo I got when I was 18. You know, each day while I was getting ready, you know, I would look at it and I just started to get tired of it.
It's really interesting when you look at a process that was meant to be so permanent, yet we're trying to find a way to get rid of it. Up to this point, a lot of the lasers that have been out there have caused scarring or have had difficulty removing certain colors of the tattoos that are there. Now we're able to get to full spectrum color and also do this relatively safely with very low risk of scarring.
You know, I felt so comfortable knowing that, you know, I was going to be under the care of an actual doctor. The commercials of them, you know, a tattoo artist removing a tattoo, you know, making it look so simple, pain-free. It's not that way at all.
As far as the tattoo coming off, I think there's just as much responsibility as the tattoo going on. In other words, there was a lot of thought that went into it, or at least there should be. And there should be a lot of thought into removing one as well. We're talking about a series of treatments, and we're having to do a series of treatments in order to make it a safe process. So we're talking anywhere from 6 to 10 treatments on average that could be separated usually by about 6 weeks. Essentially what the laser does is it goes in, we use a series of different wavelengths to go in there and essentially vibrate the molecules of the ink that are in there, and by doing so breaking them up. Then over a period of 6 weeks after the treatment, your lymphatic system absorbs these molecules and you start to see resolution and fading of the tattoo.
But I couldn't imagine going to another place and going through the actual procedure without everything that they do, in addition to the numbing, you know, that goes on before, and then they, you know, prepping the site, and then they actually invested into an air cooler.
Now that's one area where I'm very unique. I have the ability, since we're a physician-based clinic and I have an on-site pharmacy and everything else, we have the ability to do forms of anesthesia that a lot of other places may not be able to.
You know, I wish that it were already gone, but knowing that I've got several more, you know, procedures to go, it has made a difference in my life.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We have recently introduced a new treatment to our various and sundry offerings that ties in very well with our weight loss options, called i-Lipo, which is a non-invasive fat reduction technique, I guess is the best way to put it. It's not liposuction, but it does melt fat stores. The i-Lipo is non-invasive, there's no downtime, there's no discomfort, so it's an excellent technique for those patients looking to reduce fat in a very localized area without having to undergo any kind of surgical technique. The i-Lipo technique can be used in conjunction with a suction technique that directs the energy a little bit more into the epidermis itself, that then stimulates a collagen reaction. So deeper into the fat layer, it empties fat cells, but it's more superficial. The same energy actually can induce collagen response, and it causes basically a tightening effect of the skin. The best candidates for this technique are patients who have focal problem areas, such as the pooch on the abdomen, the little saddlebags that occur on the thighs. You can do it on arms. We've done it on chins. The i-Lipo, used in conjunction with a weight loss program, gets the patient to their target faster, keeps them more motivated and involved in their weight loss program because they can see the results so much faster. So the normal treatment course is 2 treatments a week over 4 weeks. You want to focus on one treatment zone at a time. The treatment itself takes about 20 minutes, but we do a measurement before the treatment and a measurement immediately after the treatment, and there is a noticeable difference from those measurements that we're able to take. I think that the benefits that the i-Lipo technique offers over other fat reduction techniques, it's its simplicity. It's fast, it's pain-free, no downtime, no recovery, and very definitive, almost instantaneous results. It's a quick fix. It's very natural in many respects.
I had sinus pressure all in this area, all the way down to the jawbone, pain and swelling, and it wasn't just occasional, it was every day. I had been to about 8 doctors in the Metroplex. All of them had told me that there was nothing there, nothing they could do for me, and to basically go home, live with it, and for me that was not an option.
In Vicky's case, she presented to me with a history of constant headaches, chronic sinus disease, and had radiographic evidence of significant sinus inflammation. She had been treated with multiple rounds of antibiotics, nasal steroid sprays, and allergy medications with minimal relief.
My first appointment with Dr. James, he told me that he thought that he could cure me, that he thought that it was a balloon procedure that I needed. He explained that nothing is 100%. This might work and might not, but I feel like with your condition, that you've got a great chance, so it's up to you whether you go for it.
Usually on the first visit, we'll discuss their history, how much of their symptoms are related to actual sinus infections and sinus issues, and how much of those relate to just allergies. And then that kind of determines what type of further evaluation or diagnostic procedures we need to do. And
he did the procedure within 10 days. I was pain-free, have had absolutely no problems since. And as far as I'm concerned, he's a godsend.
Within 24 hours of completing the surgery, her headaches had resolved and symptoms had improved significantly.
Dr. James has changed my life for the better because the activities that I pursue, I'm able to do my gardening, my housework, just general things, travel, any activities I want to do with my grandchildren, running, riding bicycles. I didn't have the stamina to do that before. Now I'm able to do even more because I am pain-free.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that have helped change people's lives.
Exactly right. And for more information on any of these great doctors you see on today's program, head to the website, bestdocsnetwork.com.
And as always, if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
And good news, viewers. Up next, Candace, the premiere. That's right, the premiere of the Best Docs Network featuring beautiful Forest Park Medical Center. Stay tuned. So long, everyone. We'll see you next week.